So high blood pressure, or hypertension, as it's known in the medical world, is the pressure that is caused by your heart pumping blood to the rest of your body. Your body needs oxygen. All of your organs need oxygen. Your heart pumps blood through tubes or pipes, however you want to think of it, to your organs. The first number, the top number, is your systolic number. That's the pressure that is created when your heart squeezes and pushes blood out. The second number, the bottom number, is known as the diastolic blood pressure. That is your heart relaxing and receiving blood back from the rest of your body. The pressure that is created is important to the rest of your body because it should be at a certain level. When it gets over about 140 over 90, it can cause problems. So generally, to prevent high blood pressure, you're going to want to work on making sure you are at a healthy weight, making sure you are following a low-salt diet, trying to get regular activity, preferably 3 to 4 days a week, at least 30 minutes. And then you want to prevent it because when your pressure is high, the pressure in these tiny little tubes bringing blood to your organs, it can cause all kinds of problems. It can cause problems in your eyes, problems in your heart, problems in your lungs and your kidneys and your brain. Easy things to remember: it can cause strokes, heart attacks. It can cause kidney failure, put you or end you into dialysis, essentially. My father's a plumber, so it's easy for me to think about this because I think about the pipes and I think about how they can only sustain so much pressure. It's easier for people to understand than if just trying to think about arteries and vessels, I think. Unfortunately, when people have just regular high blood pressure, not very accelerated, you usually don't feel any problems. People don't notice that they're actually having high blood pressure, which is why it's so important to come get it checked. And then once you have a diagnosis of hypertension, coming to get it checked regularly. Now, most people will say that they feel better once they're on blood pressure medicine, but they didn't realize they were feeling bad before they start the medicine. There are people that are higher risk for high blood pressure. Anybody with a family history of high blood pressure automatically has a higher risk. Men under the age of 45 are higher risk than women until about the age of 65, where that risk evens out and women actually kind of take the lead. African Americans have a higher risk than any other racial population. And then people with underlying sleep apnea and obesity have a higher risk of high blood pressure, which is why, again, remembering to watch what you're eating, trying to keep that weight at a really healthy weight, which is hard to do in Louisiana with all this good food, but it can be done if you outwork it with some exercise. The recommendation is, if you have no diagnosis of high blood pressure, to come get it checked at least once a year in a screening or annual wellness exam. If you have a diagnosis of high blood pressure, you're going to want to come at least twice a year to see your primary care provider to make sure that the medicines that you are on are working like they should be. Your goal blood pressure, if you have a diagnosis of hypertension or high blood pressure, is less than 140 over 90 if you are less than 60, or if you're over 60 and have a diagnosis of diabetes, chronic kidney disease, or vascular disease. If you're over 60 and you have no other diagnoses, there is a possibility of having a little bit higher blood pressure range, up to 150 over 90, but those discussions should be had with your primary care provider to make sure that you are a candidate for that.